The listening part of the occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a health professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Mrs. Melissa. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, doctor.
Good morning. Please be seated. May I ask why you have come to see me?
Well, I have had a sudden onset of pain by lifting a weight of about 40 pounds at my workplace. I have developed pain on my left hip. Although the pain is dull, it is aching and stabbing. The severity ranges from mild to severe. The pain is present constantly and worsens while sitting, twisting, lifting, or riding in a car. The pain improves after resting. Sleep alteration due to pain is positive, and I wake up after getting to sleep. I'm feeling depressed all the time due to this persistent pain and have lost my interest in all activities. I get insomnia, lack of concentration, fatigue, and loss of energy.
Do you have pain on your spine?
Yes, doctor.
Your age?
48, doctor.
Are you attending your work?
No, doctor, I am not going to work.
Have you been immunized before?
Yes, doctor. I had flu vaccine 2 years ago and pneumonia vaccine 5 years ago.
Do any of your family members have a history of illness?
My father is 79 and had a cerebrovascular stroke and hypertension. My mother had a congestive history of heart failure and died at the age of 70.
Tell me if you have any past medical history.
I had an appendectomy 7 years ago and a cholecystectomy 3 years ago.
Do you drink or smoke?
I used to smoke before, but I have stopped smoking nowadays, and I drink socially.
What medications are you taking now?
I am taking Lortab 10 milligrams whenever I get pain.
Are you allergic to any medication?
No, doctor.
Well, your MRI shows small central herniated nucleus pulposus at L4/5, bulge at L3/4. There is a shallow left parasag, herniated nucleus pulposus at L5/S1. There is an entrapment of the superior gluteal nerve in the aponeurosis of the gluteus medius left, and you are also suffering with depression and sleep disorder. So I would recommend you take a treatment for superior gluteal nerve block left. I am going to prescribe you baclofen 10 milligrams before bedtime, flurbiprofen 100 milligrams twice a day, hydrochlorothiazide 25 milligrams once in a day, and Klonopin 0.5 milligrams before bedtime. Continue these medications for 3 weeks and meet me thereafter for a scheduled follow-up for medical management and reevaluation of your condition. Depending on your condition after 3 weeks, I will decide if any diagnostic or therapeutic intervention is required or not.
Okay, thank you, doctor.
Extract 2, questions 13 to 24. You hear a physician talking to a patient called Rasputin. For questions 13 through 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Extract 2. Good morning. Please take a seat. Tell me about your problem. Good morning, doctor. I currently work as a phlebotomist and respiratory therapist in a hospital. When I was attempting to do a blood gas, I had my left hand finger over the pulse and I was inserting the contaminated needle using my right hand. I was wearing protective clothing and gloves. As I advanced the contaminated needle, I jerked away, causing me to pull out of the arm and accidentally pricked of my index finger. I was seen and evaluated at the emergency ward immediately. In the diagnosis, I was found to be a carrier for hepatitis C and negative for HIV. I had a periodic screening including blood tests. I completed a 3-shot series for hepatitis B and had titers drawn that shows protected antibodies. I am up to date on my immunization including tetanus. What's your age? 36, doctor. What medications are you taking? Nexium. Any previous medical history or surgeries? I had degenerative disc disease in my back. Are you allergic to any medications? I am allergic to IV contrast. Are you continuing your work? Yes, doctor. Well, your temperature is 97.2 degrees, pulse rate is 84, respiration's 14 and unlabored, and blood pressure 102/70. You are negative for HIV. You have no other symptoms suggesting acute hepatitis. Your liver function test is normal at 18 and you have no signs of infection. You have developed acute intestinal illness due to blood-borne pathogen exposure secondary to contaminated needle stick. Continue with Nexium 20 milligrams a day until the condition improves. Otherwise, you are medically fit and no need for further diagnosis or treatment. Thank you, doctor. That is the end of Part A. Now look at Part B. Part B. In this